What's up, everybody? Shawn here with another bonus live Live to Roll this Thursday. We're going to be talking a little bit about bladder management today, but it's more of an open discussion. So if you guys have any questions or anything you want to mention in the chat, please drop those into the comments, the chat, so we can hear from you and get you involved in the conversation. And we have an awesome panel, I feel like, today, too, with three guys. So I am Shawn. I'm a C5, C6 quadriplegic from a snowboarding accident 21 years ago. Bobby, you want to go ahead and then we can let the ladies?
Sure, sure. It should have been ladies first, but I'm Bobby Rohan, C5, C6 quadriplegic of 36 years from a bicycle accident living in Southern California. And I'll do it to the veteran, and then the veteran can go to our rookie today. But Brianna, take it over.
Hello, fam. My name is Brianna. I was injured 9 years ago from gun violence. I'm a T12 paraplegic and I live in Los Angeles, California.
Awesome.
Hi guys, I'm Gretchen. I C5 C6 quad of 10 years from a DUI crash, and I'm so excited to be here with you guys.
Awesome. Yeah, I'm glad you guys could join us as well. So it's not just guys talking about catheter stuff. It's good to have both perspectives because I know you guys have other complications that we don't have sometimes. You know, it's not quite as easy sometimes to manage your bladder health. So let's get into kind of talking to that. I know one of the things we'll talk about is Botox because I know Gretchen's had a little bit of stuff with that, and I've had my issues with that. So I'll we can both kind of share on that. But yeah, so for me, I feel like maybe we can just start off real quick with Gretchen. There we go. We can go ahead and start off just kind of real quick, just kind of telling how we manage our bladder, and then we can kind of get into some of the other nuances of that, and problems, pros, cons, all that stuff. So for me, I use a suprapubic catheter, which is an indwelling catheter that's surgically placed in your belly. And Bobby here was actually the one that kind of nudged me in that direction, and it's something that I haven't regretted, and I feel like it was a good decision for me to do. Uh, so yeah, no, thank you, Bobby. I do appreciate your guidance there in the beginning because I didn't know what to do. Um, so you want to mention? I know I obviously just kind of mentioned you do have a super pubic as well, but
Yeah, but that's a good point. Just talk about why it was good and maybe what made you want to change whatever was going on. So and because I kind of don't even remember this story. Was it just because cathing was hard, or
um,
you're
cathing was hard for me. I couldn't figure it out with my hand function because every time my bladder would start to get somewhat full, my hands clench up like tight into fists, and I just start to get really spastic. So it becomes very hard for me to try to do anything like using an intermittent catheter. But I actually left the hospital using condom catheters, which is exactly what it sounds like. It's for males. It's basically a condom that goes over your penis, and the top has a tube that connects to it, so that you just pee directly into it. It just basically just allows you to pee straight into a bag. And my issue with that was I wasn't fully evacuating my bladder. It wasn't like a complete evacuation, and I was just having trouble with them coming off and then ending up wet and being having sitting in pee for the day and out places. And yeah, like it seemed like every time I would try to transfer or move, like any motion movement, the bag, it just always at one point in the day seemed to become loose. So I was just really frustrated with that, and I couldn't figure out what to do. And I honestly was a little bit afraid of the super pubic, but you kind of told me that it wasn't so bad. Like it was pretty easy. You could have a lot of independence, which is one of the main things I wanted early on, was to be able to empty my bag myself and to be able to do it, not have to have somebody come with me to the bathroom every time I had to pee through the day, or so I didn't have to have somebody with me like at all times. That was my main thing, was like, okay, I can empty this on my own. I don't have to rely on somebody to pee.
but what was the bigger reason I told you to go?
Oh, that the and yes, the reason that sold it for me, and Bobby does remember this, I'm sure, was because he told me that sexual function was you could have sex with no problem. You didn't have to empty your bladder first. You didn't have to worry about peeing on your partner, and it was just out of the way. You just had to move the tube out of the way, and you were ready. So I was like, okay, that's that. At 21 years old, that was the clinching. That was the final pin. Like, all right, that's sold. I'll do it. Yeah, and so that is another benefit to the super pubic. Is yeah, you don't have to worry about having a full bladder or anything like that before
Or leaking, or
or leaking.
yeah,
Yeah,
yeah. It just, you don't take anything out or put anything back in. Um, just move it to the side.
yeah. So that was definitely one of the factors for sure. Was just like all those things made a lot of sense to me, especially at 21. I was like, no, that seems like the way to go. I have independence. Like I'll be able to have sex without having to like be so worried and afraid. Like, although obviously I still was super nervous and worried in the beginning and afraid about anything. But but yeah, those were the factors that kind of made me go this route. And for me, it has worked fine. Like it was, to be completely honest, the first probably maybe 3 or 4 months, I was pretty conscientious about the tube coming out of my like belly. Every time I would look down, seeing it, it was a little bit like uncomfortable. Like, but I feel like just after the couple of months, it just sort of started to seem normal. Like I just got used to it being there, and
It grows on. It kind of like it grows on you. Kind of stop being so conscious about it.
yeah, yeah, exactly. You stop being so hyper aware of it and like freaking out, like, oh, what does this look like? Oh, what if somebody like, even I didn't want anybody to see. I just felt weird. I felt like it was gonna like pull out. I felt like, all these things. I had all these fears that like something was gonna go wrong with it. But yeah, no, just after a couple months, it sort of eased. Just you just got used to it, and now I feel like if I looked down and didn't see it, it would be really weird not to I would feel very funny even when I get my catheter changed, like when it's out for that minute or whatever, it's out of my belly and there's nothing there. It looks strange when I look down, like it not seeing
Yeah.
it.
Yeah, I can see that. I can see that. But it's funny. Mickey said much more freedom. Mickey, if you can elaborate, like after 35 years, why was it more freedom? Because the one complaint I always heard, why people continue to cath for so long, is because they don't want to wear a leg bag.
Yeah, that's
Um,
the thing, is the leg bag. The
right,
thing
and so,
that was the other thing that you showed me, was you were wearing like a very cool, like it was called the sport bag, which is the same bag I still use. It's worn on your thigh so you can wear shorts. It's relatively unnoticeable as unless it like slides down towards your knee, but if you keep it up on your thigh, you barely even notice it. Like if it's very full, you'll see the little like bulge of it under my shorts, and it looks like you can see on my leg. It looks like I got like a growth or something coming off my thigh, but like like it's honestly mostly unnoticeable to people. So
and you
um,
just tell Leah, "I'm happy to see you."
yeah, yeah, that's she liked that one.
I knew I would hear it.
Uh,
Little delay there, Leah.
so what about you ladies? How are you guys
Yeah.
managing your bladder health?
Or
Brianna, you
first
want to
talk
go?
about, yeah. First talk about what you use, and
Or yeah, like what
uh,
you use?
yeah, and what catheter and all that.
You can go first. Sorry, I was muted.
Okay. So I guess if we're talking about like the origin story, I guess, of how it all came about, I think like early on in my injury, like while I was in rehab, there was a nurse always doing the intermittent cath, and I didn't really have a Foley at that time. That was only during the first 2 weeks of like acute rehab. But once I got into like outpatient, inpatient where I had to be like more active, they were doing more intermittent, and so they sent me home learning like using the mirror and then the thigh spreader device in the hospital, and I never really got a hang of it as a quad because I just didn't have that function to sit up in core strength. So I needed help like leaving the hospital, and for about 8 months post injury, it was kind of like I would have my mom do it for me, which was so like I couldn't leave at certain times, and I couldn't go outside. I had to come back home and then do it on the bed, and like all of these things, right, in the first 8 months. And then there was a time I remember clearly when my dad, so both my parents are healthcare, they're both nurses, but my dad works in mental health and my mom works with babies. So they're not very, um, they weren't very educated on adult care. And so they had to learn with me. But also, there was a time when my mom went back to work and my dad was in charge of my cathing. And I just remember being like, oh my gosh, this sucks, but it has to happen, all of these things. And he was very uncomfortable with it as well, but we just kind of got over it. But there was this one particular day, it was on a weekend, I remember clearly, and my dad was just like, enough is enough. I'm locking you in this bathroom and you're going to figure it out. And it took me a really long time to figure out how to intermittent cath with a catheter. But like that day, I figured it out. Like I figured out how I was going to do it with my hand function. Because I have left-handed grip, but it's weak. And then I don't have any grip on my right. So I had to figure out how I was going to do that. And if I was going to do it like from a chair, from the bed. But I was in a this Permobile power chair, and I figured out how to do it that day. But he literally left me there and was like, no, we're not doing this anymore. You're going to figure it out. And that was 8 months post injury. And so ever since, I've been using the cath and bag. And so that has really helped just in terms of like I can cath wherever, whenever. And that's really helped. But I just remember that being like my origin story of how the cathing situation went and how I learned how to cath. But it was like one of those times when I was like, oh my gosh, I can do this. And then it kind of opened up worlds for me to like leave and go with my friends and stuff once I truly figured it out. But yeah, that was where it was a painful start for sure.
It was kind of like your dad put you on top of the high dive, platform and just said, I'm taking away the ladder. You'll have to figure out how to
Exactly.
get down. So that's a good little push. And one question I have that I know for women, a lot of times, and some of the coworkers I've had over the years, they'll be like, I have to go to the car because, trying to scoot your bottom out and, kind of be in that laid down position. Is that like for you or, do you have to
Yeah.
recline a little bit?
So I think it took a while to kind of figure out what worked best because initially I had been always on the bed and someone else had cathed me, but then I couldn't sit up to cath like on the bed because I didn't have that core strength. So I needed to be in a chair. And so like a lot of people I know now, like they cath in bed, but I've never cathed in bed. Like I've always done it from my chair. And
Mm-hmm.
so for me, it's more like I have some movement in my lower extremity, so I can move my legs a little bit. So I'm able to like lift my legs in a position onto my chair, whether it be my power chair or my manual chair. And so I can get in the position that feels comfortable to me and I'm not like falling off the chair, if that makes sense.
Right. That's good. Yeah.
And then
And what type of, just for those out there, what type of catheter do you use? I know you
Yeah,
said the
so
one
So
with,
I use. Oh, sorry. I thought you
or
were.
what, yeah, no, just what brand
and then Brianna,
Are
then
you?
yeah, I do want to hear yours too. Yeah.
Oh, okay.
yeah, so I use two different types of catheters because of insurance. So I use Coloplast, which is, I think most people probably know what the Coloplast cath and bag is. So it's like this tube, and then I use my teeth to open it, and then the bag is on the inside. And then I also use a different one through Hollister Catheters, which is also a cath and bag, but it comes in, I don't have it with me right now, but it comes in more of like a package. I use those at home because I don't have to travel with those, but these I can easily slip into a bag. But yeah, I use both of those.
Awesome. All right, Brianna, you want to go ahead and explain? Yeah,
Yes, of course.
your
So my
origin?
journey was a little bit more different for me. In the beginning, they were just straight cathing me when I was inside of the hospital and rehab, and I didn't have much feeling, so it wasn't like the biggest issue. And then they had the Foley catheter, they actually tried that out for me while I was like being transported, I think for like a week or two. And so I felt the freedom of having that. And then dealing with having a straight cath for me, I started to be able to feel the pain of it going in and out. And then I needed a lot of assistance, and I wasn't able to like find the right spot for it, especially like being newly injured. At the time, my boyfriend was my caregiver, and he was already doing a lot for me because I didn't know how to do anything. So he was helping transfer me. I was still in so much pain, and it was just like another thing on our list. And so after trying it for a few months, I was like, okay, let's try the Foley catheter, and that was just easier for me to deal with than I was dealing with depression at the time as well, and dealing with the pain every single day on top of it was extremely overwhelming for me. It was just another thing that I feel like I couldn't manage in my life, that was out of control, that, you know, got taken away from me. And it was something that was a big relief to be able to have the Foley catheter. Now, I do want to explore some options with surgery, you know, but I'm a little bit nervous about it, and I'm nervous like about like the different complaints that each person has, and I feel like I'm just like putting it off for a long time. But majority of the time, I'll use a big bag to go to sleep, and then if I'm going out or traveling, I use a leg bag that just helps me. I can empty it in 2 seconds, and it just gives me a lot of freedom as well. But it is something that's constantly attached to me, which I don't like. I'm not a big fan of.
Yeah, it is hard to get used to the like having the bag kind of all the time. Um,
Mm-hmm.
but yeah, so are you thinking about doing like a super pubic if that's your surgical, or something even
Yeah,
different, more
I'm
like
not sure if it's like a super pubic or there's another one, like with an
the
M. Yeah,
Mitrofanoff or Mitch
yeah. It's so hard. I
something like that.
honestly feel like I hear such different reviews from both pros and cons, and then like doctors as well give me different reviews as well. And for just the type of person I have and the anxiety I have, it does not sit well with me. I'm so nervous to go through the pain of doing the surgery, and then it just being like an extra pain in the ass on top of everything, you know. I am nervous about the recovery time for the surgeries, only because yeah, I do all my stuff myself, and I don't have the support like that, so it does make me super nervous. And I hear recovery time is different for every person, is so different, you know, so it's hard to kind of like wage out how it's going to hit my body or how it's going to affect me. And that all together just gives me so much anxiety, and I just keep pushing it off, you know. Yeah.
Yeah. No, I don't know what the recovery time on the Mitrofanoff or Mitropanoff. That's what it's called, Mitropanoff, I think. The
Yeah, it's a weird name.
Yeah,
I don't even attempt to
Yeah,
say it.
no, I always want to make it like
it's a
sound
European
more Russian. But yeah, no, that's the one. I'm not sure what the recovery on that one is, but I know for the super pubic, the surgery is super quick. It's not even you're in and out of the hospital within a couple of hours. Um, and then the recovery, I'm trying to think because it's been so long now for a while, but I feel like it
Well, I
was just kind of
mean,
bed rest for a few days because you didn't want to
yeah,
be transferring and moving with the. But I don't feel like it was a really hard, like tough recovery on it. You would probably just have to have like the week or so bed rest, I'm sure. So have that you would have to probably
yeah,
have extra help,
Yeah,
but
which is so interesting because I've heard that like people have taken months off, that it was like an extremely hard and painful surgery for them. So that's what's like so hard, is because like, yeah, I exactly what we're talking about. Like I hear both reviews. Some people are like easy breezy, like best decision I ever made, and other people are like, oh my gosh, I cannot believe I just did that to myself. And I'm like, I'm so those are very big, like, you know, like things. And it's like most things in the community, our bodies are so different, so it's so hard to even like give straight advice to people, because I always tell people like that's the way it works for me. I don't know how it's gonna work for you, like trial and error, like everything, because what like my remedies might not work for even
yeah.
any of you three, you know. So that's what's so difficult about it. But I think I'm gonna take the leap. I just need to, yeah, plan it out more better. I'm getting more like lean towards just like taking the leap and doing it, you know. The chat is moving so quick. I feel like I just saw my name
I
right
know
now.
it is,
Yeah,
and
no, it's
you
going
know there was.
very active.
Oh,
I
Leah.
know I
Hi, Leah. Thank you so much. Hi, everyone. Thank you guys for all commenting. Appreciate you guys being here. Okay.
Yeah, I know.
Jay,
Um,
I want to know one question from Jay because he uses the suprapubic where he uses the valve, no leg bag. So when he's
I
got to go, he just opens up that valve. And I would just want to know if that's the way he did it since day one, or
I
did he
feel like
have to work his way up?
I feel like most of the time you probably have to do that from the beginning because your
I
bladder.
know.
I don't know for a fact. I'm not a doctor, obviously, but I'm pretty sure it shrinks pretty quickly. Because I know for both of us, like my bladder, I don't think is much bigger than like a racquetball. Like, like it's pretty tiny. Like I fit.
All right.
I think I was going like when I had really bad AD and I had my catheter clogged and blocked. Like nothing was flowing, but I was just like it wouldn't flow out of anywhere. That was back when I had Botox, so I wouldn't pee. I bladder wouldn't leak. I had to get intermittent catheterized, and I think they only got like 450 out of me or 500, and that was like my bladder was like I was like AD blotching all over my like I was maxed out, you know. So I don't
Mm.
know.
Yeah,
Yeah, I think also like to add, like your bladder is a muscle. If you don't use it, right, you lose it. So
yeah,
if you're using your bladder, you just have this constant output from a catheter always being in there, then it's going to shrink, right? So I think someone said that, right? Derek said, has anybody else's bladder shrunk? Yeah.
Oh yeah, that was
Um, yeah. So that usually happens, but I'm not sure if you guys have done like the urodynamic testing where they like fill up your bladder and check how much like you can hold, and you have to do that to see your bladder health and how much it fills up and stuff. Yeah, so
yeah.
that it's mostly probably because you have a Foley, or you have a catheter
So
always
I've
in there. I'm not.
Yeah,
Mhm.
I've had mine for 36 years and I did it once, 5 years
Right.
after my injury. And I just remember them filling that up and I went, no more, no more, no more. And my head is
Yeah.
about to explode with AD. And
Yes.
every time my urologist brings it up, I go, no, we're not doing that. That
Yeah.
that
Exactly.
that is an instant headache. I mean, unless you're telling me I don't need my I can't have it for whatever reason. And that's the cool thing. I mean, I remember some doctors telling me like that is a short-lived, short-term answer. What you've done, when I've gone into other urologists and they're like, wow. And then it's so funny. I've had others like, oh wow, that's great. You have that. Yep, you're fine for the rest of your life. And I think
Yeah.
it's all about care. And I think that goes for any of us. If you got, a Foley, or if you're going on your own, or you're intermittent cathing, or the Russian name, Atrofidov, um, I think it's just about the care and then what management you do.
Yeah.
yeah. No, I think it is a
There
lot.
was Mickey put something in the chat that I thought was interesting. She uses a Foley when she travels,
That's when
and
she used to. That's when she used to cath. Um,
yeah,
Yeah, which I always thought, let me know. I don't know if either one of you have tried this, but I've always heard if you're trying to cath every day, you don't want to try to do that because then your body starts to get confused. Like, hey, can we go now or can we not? I don't know. Let us know in the chat if anybody else discovered, like,
yeah. I think so. I mean, I had to use a Foley both when I went to Italy and when I went to India, because the Indian flight was like 20 hours long. There was no way I could guarantee that there was going to be a bathroom, an accessible bathroom on the plane. And so I ended up putting a Foley in, and that was quite an experience. But then I also did it for when I went to Italy, which is a little bit less time than, but it was still like an 8 hour. And then I also did it one more time when I went to Spain and Portugal. So I've always found it like, for me, I just don't know what the situation is in different countries, whether I'm going to have an accessible bathroom or not, and if I'm just going to be able to like cath in the middle of the street, which is not ideal in a different country, and we don't know their cultures or we don't know certain things, right? And so I put a Foley in, and like I said, both my parents are nurses, so my mom was able to help me put a Foley in before. I also had the option of going into the urologist office and getting it put in. before I actually flew. But for the India trip, I ended up having, I went into AD in the middle of the flight because it had a kink in it and I didn't know. And I was just sitting there. So I ended up having to go to the bathroom using the aisle chair in the middle of that flight. And I think it was like 10 hours into the flight.
Yeah.
So it was a little crazy. And I didn't know what was happening. Like because I didn't have this issue before, but I had to go and use the bathroom and I had to like unkink it and everything and make sure that it was flowing right. And then that ended up working out. But it was like difficult, because when you're in the middle of the flight, it's like how you can't just like have an area to just like take the balloon out and everything and take the entire Foley out. So it was like an interesting experience. But when I'm
Did you
actually
leave it for your trip, or did you take it out during your trip and then put it back in?
yeah, yeah, so when I'm actually in the country, so like when I go to India, I stay with family, so I brought a few extra and I was able to take it out, and I stayed pretty much in that area, so I was able to intermittent cath. But the when I went to like Italy or Europe, we were kind of like in a 10-day trip or a 2-week trip, and I didn't know where I was going to be from day to day. Like I was going from different hotel to different hotel, and I didn't know the area well, so I couldn't just be like, oh, there's an accessible bathroom. Which there weren't in Italy and stuff. There weren't as many. It was very small, so I was very glad that I didn't have to like go and cath, and I could just empty the bag, which is why I was kind of curious about the valve because I ended up using that a couple of times, um, and taking the bag off a few times because it was getting heavy on my leg, and so I just was like, okay, I'm gonna use the valve. But I also wondered about that too, like if that would cause like irritation in the bladder because you were just allowing the urine to just kind of stay there until you released it. So um, to your point, Bobby, I'm not sure like if it exactly like ruins your bladder, but I felt like it was like a convenience thing.
Yeah. Well, and I can understand that. It sounds like from Angry Quad and Eric that, yeah, you can retrain your bladder. And Angry said, but be aware your body will let you know that you probably have the cat. So, and you said it best. I mean, and it's um, your bladder is a muscle. So I guess, retrain that muscle.
Yeah, I
Yeah,
think
and
probably like the day after it's like a little like wonky, but I've talked to a lot of girls in putting a catheter, and there was only one person, Ashley, one of the twins, who had like some AD problems with it. I'm not sure like if it was inserted wrong or what, or her body just was like reacting to it the first time that she tried it. She hadn't tried it before at all, which I think that you should try. If you're gonna go on a trip or something, I think you should try it out like maybe even like a month before, just to see how it works, how your body reacts to it, so that you're not just like, in the air and all of a sudden your body goes into shock and you're like, what do I do? Or whatever the case may be, in the car, a festival, whatever the case, whatever the reason why you're wearing it. They also sell caps. Caps are another thing that helps girls, or guys, whatever, like, just you can cap the catheter, the like, I don't know what to call it. What is it called? The like actual like catheter part. And then you can just put a bag in when you feel yourself like filling it up when you have to go pee, so you can just have it ready and basically attach the bag when you need to.
It's like kind of putting a lid back on the water bottle.
Yeah.
Mm-hmm. And, when you said, Gretchen, about the bag getting too heavy, were you using the big like overnight bag or were you using a leg bag?
so I had like multiple different ones. I used an overnight bag for actually, you know what? I think it was the Coloplast. I think it was a Coloplast leg bag. I'm pretty sure. And so it was like smaller, and so it like if I couldn't find a place to like dump it, it would be harder it was hard to find places to like
It would
just
start
dump.
sliding down. It would start sliding down your ankle and stuff.
Right. And then I would like be one of those people that would hide it with like I would be wearing like a maxi dress or like jeans that would go over it. And so then it would be tightening on my legs or something. And so then it was harder to manage that way. Like I felt it really heavy.
Well,
And so,
next time,
yeah.
Shawn and I will get you a leg bag that sits on your thigh, and you won't have to worry about that.
Yeah.
Yeah, I
And
did
I
not
was
realize
also
there was.
gonna say one of the tricks that I use is the catheter bags come with an extra little tube, the leg bags, and I throw the tube away and I throw the little straps away and I just attach it straight to the catheter and I just keep it on my lap and then I wear a dress over it. So then that like really helps like a lot covering up,
Oh,
even if it like gets full or whatever. And it's easy to like manage and everything. And it like reminds me as well when it's full, that's what's easy. That I've used that trick and I have not gone back. I cannot use it like on my leg. It's so uncomfortable and it really does mess up my outfits if I'm wearing like tight jeans, like you
yes.
said, and like a big old bulge all of a sudden like out of my leg, which
Yeah.
still does happen on my leg too. I mean, like on my stomach area if I'm wearing tight pants, but you just have to be cautious of it. But yeah, it's easier that way. That's another trick that I use. I don't know if
And
you've ever done.
how does that? How do you manage your transfers like that?
Yeah,
Do you
that's
just
It literally just stays on my lap like when I transfer. Like
okay.
so
I arrange
your legs?
it
Don't,
enough.
you're not afraid your legs are going to go apart, or because
No, because
if
I
you're
kind of like secure it with my pants or underwear or whatever that I'm
Okay.
wearing, and
oh
then
you're
it
stuck.
keeps it tight enough for me
Okay.
to like when I'm moving, it's together. My legs stay together. Even if my legs go apart, it doesn't like fall in between because of my pants are on. And I've honestly even transferred like in a dress before. It's kind of just like tucking it in that helps
Yeah.
the best.
Yeah,
Um,
Mickey just
Like
pretty
even
much.
into your underwear, you could just tuck it in for the moment when you're
yeah.
transferring.
Okay. Wow. That's
Yeah.
kind of like with my leg bag. I mean, I wear, and now I wear, and I would first for the longest time I wore bike shorts, and the reason why I wore bike shorts is because then I put that on my leg, and it was tight enough that it held it right there. Yeah, I
Mhm.
still need a strap, but it would hide the tube and everything. So, because when
Mhm.
I get that shorts on and then tidy whities, that bag moves around a lot, and then
Mhm.
it was just the tube would pop out, and I'm like, ah.
Mhm.
And so then I started wearing those bike shorts, and it hit it. And now, like jockey makes a long underwear that has 11-inch inseam, and now it's getting hard to find where I have to take them into the seamstress and make it just a little tighter around the right one. I'm like, can you make it just tight on the right side? And she goes, huh? So it just keeps it tucked, everything tucked in. So I don't have to worry about it sliding out the end of my underwear or my shorts to show. So that's how I've always managed.
That's one thing that does drive me crazy sometimes about the leg bag if it'll slide around and stuff. And I always thought your shorts idea was good. For me, what I do is I just when I first put it on my leg, like put my shorts on and the first transfer into my chair, I just make sure it has to be up way up on my thigh, like pretty much as high as it can possibly go on my thigh. If it doesn't, it starts to slide with every transfer I do. And then after like three or
Mhm.
four transfers, it'll be at my knee and then hanging under my thigh, like under my knee, below my, like it just if it gets full, it's just too much. So that's one thing. I secure that sucker from the start, and as long as it's far enough back to where basically I'm sitting on the strap, like the strap is under my leg and the cushion, that kind of helps. Even when the bag's full, it keeps it from shifting or moving. But that's my
Do
way
you,
of doing that.
I also have used those little sticky pads. I don't know if any of you guys have used them. They sell like little sticky pads, and it basically secures the catheter in place, so it
Yeah,
doesn't move
those.
like right off the tip. I hate taking those off, so it messes up my skin underneath, and I'm not the biggest fan of it, and that is why I avoid them at all costs. Um,
Yeah, you'll
but
never
yeah,
get
I
those
don't know.
things off. They
Yeah,
like, I mean, you got to have a razor blade to like,
yeah.
they, and so people like nurses always ask me in the past, like, how come you don't secure your catheter down? Like, with what? And they're
Hmm.
like, oh, like this. And I'm like, no,
Hmm.
because
Yeah,
that's not.
they every time I've got it, it's because the hospital insists on me putting it on, and I was like, I hate this thing, man.
Mhm. Yeah.
Yeah,
Which
yeah,
is why I learned how to do it myself too. Is because going to the hospital was just so frustrating. But when I do tell them that I do it myself, they do get a little wide eyed. So I would say like make sure that you know all your steps and that you're being like sterile and everything. Last time the nurse was like, how do you do it by yourself? And I was like, I just do it. I don't know. I just do it. I just set it up and I learn and I watch, you know. But that's only in case of like emergencies, like knowing what to do, you know, if it was to come out, if you were in a different place, it's good to know that knowledge. So I would like Google it and like watch a video or ask like one of your will friends, you know, or message me if you're a girl and I'll help you out as well. I don't have a problem. I've explained it to multiple people too. Just so you know the way it works, you know, what you would need if it did come out, what you need if you had another one, like what to ask for if you're in a different state. All those things are really important to like notice, you know, about it.
Yeah. Um, I'm going to do a pet peeve. My pet peeve of the hour is please do not put your night bag onto your super pubic or your Foley and then have it on the outside of your power chair or walker hanging there where everybody has to see it. Um, please use something else. You know, when I see somebody using those, and I get it, some people don't get a lot of supplies or maybe don't know how. But if you're one of those, reach out and let's get you hooked up with some leg bags because don't be that lazy. And if you are going to have to use it, find a little bag to cover it and be discreet about it. There's nothing worse, especially at the Abilities Expo, when you turn around and all you see is this big yellow, and not usually yellow, but usually dark, disgusting sewage water inside these bags. You're like, come on, we don't need to see this. So my little pet peeve of the
Well, a lot of people I know it is that's kind of just that just they have to be able to do that. They have care, but they do make a lot of bag covers and even tube covers now. I've seen that like you can actually even put like it's like a tube cover that goes over the whole thing, so you can't even really see the the urine in the clear tube or anything. So those are, yeah, those are cool options that I like for doing. And I will shout out our friend Nico because he was always doing that. And then last few times I've seen him, he's got it all tucked away, got a nice little bag for it under his chair. It's all clean looking. And so yeah,
not I
They do
not
sell bags for them. I even have like a bag that's crocheted. So if you have like a
nice.
crocheted friend or like one of your aunts or family members, like get it measured out and do that. That's my favorite because I get different colors and different patterns and stuff like that for emergencies when I have to wear them out. And also like I bought them online as well. They sell like just plain black bags to cover them too. If you
I was
want to
gonna say
search on like Amazon.
I've actually used it because
Are you bag shaming?
yeah, I know Olivia called
no
me.
or Leah, I don't know what you do on your own time, but no, I do not want to see it. We don't have to see.
Uh, but you can even just use a regular like the Abilities Expo bags that they give you, like just that thought the fabric like grocery bag style. You just throw it in there, tie the little loops into a knot, and then hang that from below your chair. Because I've actually done that before when I've. That's what I did
Good
going to
idea.
Switzerland
Yeah,
actually. That's what for the because my flight for Switzerland I did the same because I wore my bedside bag for that 11.5 hour flight, and was just like yeah I just threw it in a thing and hung it on. I still hung it between my legs, like on my little my cushion strap that has like that little handle in the front. It's perfect for the leg bag or for the bed bag little hook. Slides right in there, and then it just like dangles there between your legs.
yeah, exactly. And
Mm-hmm.
it's easy to cover, and that's what I do too, Sean, is I get a Ziploc bag. So one, if happen anything leak out of the night bag, I always call it the night bag, but then it's sealed in. We zip it all the way up, and then I put it into like one of those string bags that you can use, and then it's all discreet and for those long flights, and you don't even have to worry um, about you know diminishing your intake of your water because when you travel it should be the opposite because a lot of us go, oh, I don't want a cap on the plane, I don't want to do this, so we decrease, and that's actually the worst thing you can do because you actually get dehydrated when you're on those airplane rides. I'm probably, how long was India? Like that, it'd be like what,
Mm.
92 hours.
Yeah. It's like 20 hours. It's a good 20 hours. So
That's a long.
definitely you got to be hydrated. And that was what the other thing I was worried about too was like, at least with the Foley, I could eat and drink whatever I wanted, and be
Mhm.
fine, and I could be hydrated. So I was drinking like 4 or 5 water bottles and just having to empty the bag on the plane. So that worked out really well. But it's also a challenge because even emptying out the bag, like mid-flight, I remember I had to be on an aisle chair and they took me as close as they could to the bathroom, and do it that way. But like, yeah, if you have like a bottle or something like that, it works too. But I mean, it's just there's so many different ways of doing things that like I learn something new every single time, and so that's kind of where I'm at. And then like just learning from you guys, I didn't even realize it. Like, how do you travel with your bag then? Is it on your lap?
So
Like,
what we do is
you
you
put it in
you're
a bag,
wearing so you're wearing your regular leg bag that's up here,
right?
right? And then the night drain bag you hook into the end of this
Right.
tube, our valve. And it's funny,
Uh-huh.
Austin just asked, how do I can't explain how to cut the tube. And if it's anything like this tube
Yeah.
comes way longer. So then you just plug it into here. You open it up, it drains into there. So when you land, all you have to do is disconnect it. And we always
Got
carry alcohol pads, just and gloves,
it.
and close it back off. So now I got my leg bag still on. And then Austin, you were like, this comes so long when we first get it. I have a thing. I just say, um, fold it in half, and that's where you cut. So just try
Got
to find that little sweet spot. And so as I was talking about, my leg bag is covered with these shorts. And then so now when I want to hide everything, I'm able to tuck it into the shorts.
Yeah.
And then
Okay,
now
that makes more sense. Yeah, because I was like, where do you what like how do you travel with it? Like, because I have it always. I just have the leg bag strapped to my leg, and then it just like I have jeans over it or a dress over it, and then.
mm,
But it's always the most annoying thing when I'm having to transfer and like all of that in case it gets caught on
Honestly,
my
for
hair or
travel
something.
time, I wear the big overnight bag.
Yeah.
Yeah.
If I wear the little one, I'm insanely uncomfortable. It's too long.
Yeah.
It's too many hours. Like, yeah, having to transfer into the aisle chair, having to do all that, like having to worry about my intake. It's
Yeah.
easier for me to have my bag covered and just to wear my big one, and I just literally just put it on the floor, just underneath where my chair
Oh,
is at.
yeah. I should do.
That's what I did on that Switzerland flight. I just laid it on the floor, kind of like
Yeah.
down, just so like I just float and
People will
Yeah.
stare and bag shame. I'm just kidding, not bag shame. They'll stare, but as long as you can have your little cover, whatever, and like you gotta do what you gotta do. It's just for a couple hours, So
Yeah. That makes sense. Yeah.
and I wanted
and
to
no,
just
Fernando, that's not a water company kind of thing. You do get dehydrated on a plane, and you have to drink a little bit of water. It's a true fact.
did he say that?
yeah.
So
Uh,
yeah.
uh,
So Nicole mentioned about not being able to find Dimano. So yeah, you should be able to find it on Amazon. That's where I find mine. Type it into the search bar, and I usually get the Dimanos, the extra strength with the cranberry pills or cranberry extract in it as well. That mix together is really ideal. I feel like for me and for reviews that I've heard from friends, using one or the other can kind of your body get used to it more easily. So using that dual one is the best. For me. I think
yeah,
you guys need
Yeah,
to
and I think
try
neutralize.
to get to.
the show is going so fast, but I think with the time we have left, I think we should all go around on what you do to manage your bladder. I mean, we talked about cathing and going to the restroom, but are you a big believer? And it sounds like you are, Brianna, with the D-monos and plus cranberry. I'm a now D-monos fan, but I've been a big fan of my vitamin C. That's what my urologist told me. Vitamin C, vitamin C, vitamin C. I'm not going to tell you enough. Get your vitamin C supplements. So I've been
Mm-hmm.
doing that. I haven't had a UTI and like a year and a half that I was feeling crappy about. Yeah, I might have had one, but I wasn't feeling crappy. Since I, doubled up on my vitamin C.
Right
I've
on, yeah.
never heard about vitamin C. I've always been told about D-monos since the beginning. They used to tell me to take it like every day, and that wasn't what worked best for me. It helps me when I feel my UTI coming on is when I take it, and then I stop taking it when it's gone, and that's what helps me. It gives me a little boost. I do like those. I've never tried vitamin C. I also think it's not just about taking it, it is about flushing out your system. You need to do the things to make sure that you're taking care of your bladder in terms of what you're putting into it. I think water and I think electrolytes are super important to have like a mix of those two things. I think that like thinking about like your intake of if you are just drinking coffee, are you just drinking soda, or those types of things to take care of yourself matters. And you'll notice if you pay attention to them what causes your body really to have that reaction and like that UTI, and then how to backtrack it. I think I've also used just drinking straight cranberry juice, and that helps too.
Are
Yeah,
you
you just
drinking
want
the
kind of
unsweetened
want
pure cranberry juice, or are you drinking like the sweetened cranberry juice? Because that's what one thing I always used to drink the regular like sweetened one, and I realized that that's adding a lot of sugars too. You got to have that one that's
Yeah,
like
you have to do the
bitter
nasty
and
one.
nasty.
Yeah, you just gotta do the nasty one and just down like even like a half a cup, like every like few hours to just try to get it in your system. And I think it does help. Yeah, it's not the best tasting, but you can water it down too. Add water. I've done that before too. I've even added like hot water to it, and drink it when I like haven't been feeling good, and like it eases my throat as well.
hmm
Yeah, no, that is good.
And
That's what.
flushing. Oh, that's a good point, Derek. Flushing is important. I think flushing helps a lot. And you can ask your urologist company for saline flushes, or your hospital, or you can buy them like online as well.
Yeah, no, that's a
hmm
good
Just
one.
let
Flushing.
me
I
know.
actually don't flush my bladder anymore, but I haven't had.
What?
I
Why?
changed because I just don't have the issues I had before. I don't have the same levels of sediment with now having a little bit healthier diet, less sugars, less processed foods, less
Yeah.
sodium, um,
So
less
it's just that you're not getting the
supplements.
UTIs because you're
So
taking care of your bladder.
yeah, I haven't had. That's what weird. I haven't had an actual UTI. In like I'm like close to Bobby about the year and a half now. It's been or almost 2 years even. Pretty much since like Leah's been helping me keep everything way more sterile and clean and increase like some of the the sterility of some of the stuff I was doing. Yeah.
So you're actually eating a green type of food every once in a while.
I eat a ton of green
Mm-hmm.
foods and stuff now. Yeah, I eat a bunch of vegetables and a bunch of fruits, and I eat a lot less like processed sugars, especially. So
Yeah.
that's another thing that
Yeah,
does.
that's important for your health for sure.
But yeah, so those are the things that I do. I do also daily D-monos. I do 500 milligrams a day, and then I also take a cranberry pill. I take the cranberry pill earlier in the day, the D-monos at night. And then before I do my catheter changes, I'll usually do like a 1500 dose of the D-monos. So like I'll do like a high dose just to help kind of clear everything like right before the catheter change. And that system has been working for me well this last time. So that's kind of how I manage all that and um, keep it
How
all.
about how about you, Gretchen?
I forgot to mention Botox, guys. And I'll
Mm.
just go through it really quickly, but like I get Botox every 4 months. I've had it for about 9 years. I go outpatient, and so I don't need to be sedated or anything. And I have prophylactic antibiotics like the day before, the day of, and the day after. And then during the times when I feel like the 4 months are up is when I start to feel like I'm having a UTI, but it's just because the Botox is wearing off. So I'll have like leakage or I'll have like stomach pain or incontinence or whatever. And that just means I need to get another dose of my Botox. But in terms of like UTI, like I haven't had too many. And if I do, I haven't had it to where I've needed any kind of like hospitalization or medication. I usually flush it out with like just staying hydrated and eating healthier. I don't take D-Manos or cranberry pills anymore because it just wasn't. I just wasn't having that many UTIs where I needed it. But in terms of, I think the two things that really work for me is like hygiene. Like I always bring wipes and then with my catheter. So I'm always like, if there's no hand washing area, like I gotta wipe my hands. I have to be very clean. Like it's just like being prepared in those situations too. Is like wash your hands, stay clean, and then reduce your the risk and stuff like that. So I focus kind of on that, and then like Shawn was saying, definitely nutrition and then staying hydrated. Um, there are people that for Botox, they need to be under sedation and things like that. So definitely talk to your urologist. But um, I think most of the time, like, yeah, I'm able to manage pretty well with the Botox. Like, I don't have leakage and stuff like that afterwards. But there's like a couple days before I'm scheduled for my next one where I'm like, now it feels like I have a UTI, but I really don't. So it's just having that prophylactic on board too, and to talk to your doctor about that.
Oh, to be young again.
Ken just put in the chat real quick. He put that he changes his super pubic and bag once a week, which I do mine every 2 weeks now. My super pubic. I think Bobby does like 10 days, but that's a.
Yeah, I've been doing mine 10 days. Speaking of, some people say they do it. Some people, Bernard said, I don't even know what the hell that is. I didn't know you can do that. And Bernard, if you are going to flush, make sure you talk with your doctor about it. But I tried the flushing. It just makes me so uncomfortable for like half the day or most of the day. It just sets like, and probably the size of my bladder. I'm not, like Jay out there who's capping it off. I probably have, if you're thinking yours is a racquetball, mine's a golf ball, probably. Um, so I just always can't stand it. So I don't do
Do you
that.
think it's the amount of saline you're putting in when you're flushing?
I'm not
Like, do you
putting that
need
much.
less
I
at a
mean,
time?
I'm not putting that much. And so there's 2 points of it, right? You're trying to flush out the bladder, right? But then all that does is stir up all that sediment and tries to go out the tube. Well, the reason why I was doing it is because my tube was clogging, and I'm one of those that have very low sodium. So my doctors asked me drink more of the hydrators, drink more of the sodium, take the vitamin C. We've had a short discussion about this before, where someone was like, "Oh, it's the big capsule vitamin C. That's what's going to be causing a lot of sediment." Drinking a lot of hydrate stuff with sodium in there, that's going to cause the sediment. And then the other thing is you want to clean out that catheter when you're flushing, right? So you got to kind of be forceful, even if you're using like 5 to 10 cc's. You want to be forceful to flush it out, and that's just my. It's like if you're going so slow, all I'm doing is just introducing water or the solution of half water, half vinegar back into my
So
body,
you feel
and
like it's the force that's causing pain?
I just feel like I'm just trying to put something in my bladder doesn't want to have it.
Um,
It's kind of like saying the sign here says exit only.
uh-huh.
Yeah, I get a lot
Don't
of
go there,
discomfort
Shawn.
for
Don't
flushing.
go there, Sean.
I was
I
keeping
think
it
it's
PG.
also like for me, it helps the most when it's clogged. Like it definitely is like
Yeah,
an
if it's clogged.
emergency like type of situation when it like needs to be out, and that like basically keeps me from going to the hospital. Because in the beginning of my injury, I would have to rush to the hospital as I'm in pain, screaming pain, literally. And I'm like, if you have a full bladder, if you know how that feels, it's painful. And I'm like, okay, dying over here. And they're like, girl, you are not dying. We're about to give you a bed in 15 minutes. And they like make you wake there, and so it's just torturous, especially in the beginning. And then you have to like have people all up in your personal space, getting changed out, all that stuff. When for me, that easy fix of flushing it with the 10 cc's, I even have had to do it multiple times before, but it usually does the trick of getting it unclogged.
Yeah.
I mean,
Well, and the thing is, once I was flushing, it just felt like I was just taking that sediment and putting it all right where it's going to clog it. So sometimes, like, I wake up in the morning, I peed all night, everything's great, no issues, no plugging, and then all of a sudden we start flushing, and next thing you know, they're like, "What the heck?" It's not going in, and so now I'm plugged. Like I wasn't plugged before. What? So who knows?
Um, yeah, no, there's a lot of that. The cat for me, I can if I when I did flush, I would only use like 20 to 25 milliliters. I couldn't go over like I could never do like 50, 100 milliliters of liquid. My bladder it's so uncomfortable and
I've
miserable.
never, I've never even attempted to do that much.
So yeah, and then the other weird thing with my bladder is I've had a urologist try to flush it in and then draw it back to like he was trying to like break up the spasm. I mean, the clog that was in there, like the sediment. But when he tried to draw back, it like collapses my bladder or something, and it won't draw anything back. It'll push in, but it will not come back. It'll only naturally come back through the tube. Like I cannot force suction it back out with the syringe. It will not. I don't know. Whatever reason, it like even the catheter. I've watched the catheter collapse on itself. Like it was like it sucked itself. Like it.
That's what's hard about this. Yeah, everybody's body is so different. You really don't know like what's gonna work for you until you like give it a try out and like try all these different options. That's what's so good about hearing like the different perspectives too, because we've all had to like trial and error and figure out what works. And your body will tell you what works best. Like you'll know one over the other what works best for you. Like you will know. So I say like it is scary to try these little things, but it's better to like try it and like know that it's for sure not gonna work or for sure is gonna work, rather than like suffering either not going without it, or like just like feeling like you need to settle for something that doesn't work for you.
Yeah, and yeah, to each its own. Like I asked my, urologist about, and I just had the appointment 3 weeks ago. So I'm going like sometimes once a week to 10 days, depending on what my schedule is too. So sometimes I'm like, I don't want to deal with this in case, so I'm going to do it now in a week. And I said, is that a bad thing? And he goes, well, you just told me you have a good streak going without a UTI in a year and a half. So I don't think so. He goes, the reason why we don't want you to change as often is because, of the germs. You can only be so sterile, especially at home, and not in an operating room. And they come in, so, and with all gloved up. So, you know, I, I think I'm doing okay. And with that being changed back, Olivia, you're so sweet.
I
Um,
know. Yay. Thank you, love. That's so sweet.
Yes, thank you, Olivia. Always appreciate that. Uh, Bobby, were you still
For
trying?
sure.
no, I was kind of done. I was just reading Ken's. I deserve liquid IV at the grocery store. You mix it in. Yeah, I got something that's like liquid, even actually way better. It's called Limit. L E no LEMT or something like that.
Okay. Where'd
LMNT.
you get
It's
I get
element.
it on Element. There you go. I get it online. And
it on Amazon?
you can, but I think you're going to pay more on Amazon to be real. But if you go to the website, or I found it on somebody's YouTube channel, and then took their discount, and then now that I get it delivered once a month, a Riauto, so I'm paying a lot less, and I buy in bulk. And what's great is they have a coffee one that I finally found something my wife does not like. Like I love dark chocolate covered pretzels. Ugh, she's like, yuck. Now she loves them, and I hate it, and anything, yeah. Um, I used to have my own bottle of whiskey. Ew, no way. And now she drinks it. So, I finally found something, which is the element that I put in my coffee in the morning. Uh, and it gives it like a little bit of it's salty. It's very salty, but it's got some flavor, and I'll do that as a cup. And it actually, I feel like I get a boost of energy because if you're dealing with low sodium, it can make you feel lethargic, low of energy. It's got a lot of side effects. And if you're not getting regular blood work like every year at least, and not sure what's going on, with your own sodium and some of your other levels, uh, please do so because that really can help you guide. Because some of us, I know Bernard, anti-water of only 8 ounces, but uh, but some of us drink a lot of water, and if I don't drink water, I got stinky pee. I don't know if
Yeah.
it's like you guys. It's not fun to have your urine smell like crud and stuff like that. I know. I just got a text from a friend like, "Who is typing?" And all
Um,
of our
that's just, I think,
I don't know whose it is. I've tried to mute mine. I don't think it's
yeah, it's
mine.
weird.
it's one of the
It's
background
like a little
static things,
static.
I think. But yeah,
Oh, yeah, that's what I thought because I saw nobody's hands on the um, typewriter, but or their keypad, whatever it's called.
yeah, Bobby, we're out here using typewriters still.
All right, hush.
But
Hey,
we do need to wrap up.
I had
What?
typing class in high school, so
Uh, no, I don't. That's good, but yeah, I think it is a static thing. It's a little bit of some causing a little distortion on here, but we are wrapping up anyways. A couple things I just wanted to real quickly do. I had highlighted earlier in the chat. Karma had asked about doing the super pubic in the pool. For me, I've always
okay.
just kept my leg back on, had swim trunks on, and I just got into the pool. My bag fills up like normal, and I still have to get out and pee. So my bag still fills up, and I don't think there was any. I didn't have any negative effects or anything.
Yeah,
And I've been in I've been in ocean, lakes, pools. So yeah,
yeah, you don't
I
have to
think
cover
just
anything.
cleaning afterwards is important.
yeah. You do probably want to make sure it's clean, and you are emptying your bag still like normal and things. So yeah, that's
I think that's
what I
one
think.
thing when not to draw a story out, but what helped change the mind a little bit more often is I've gone to those betadine sticks. So I really do the betadine around that area. So it might be a good idea if
Mm-hmm.
you're in the ocean or your pool and you're just not sure how clean. A little bit of betadine, and you can get those sticks off Amazon in little packages.
Yeah,
Um,
that's a good advice. Yeah, that's a good tip I think for anybody that's trying to do that. Yeah, I think was that anything else wanted to mention or anything to touch on. I know it goes by so fast, especially with all of us. Like lot of information, lots of sharing stuff. But we'll continue. The bladder thing is something obviously that's a major issue for anybody with a disability. So we're going to continue, doing bladder discussions and different. Maybe even try to do the more highlighted topics so it is more specific to either intermittent cathing or suprapubic or indwelling and just any sort of ones that we can do a little deeper dive on
yeah.
everything.
Derek just asked real quick, Derek. Yeah, that is the electrolyte. Um, it is electric light, and yeah, it does cause a little bit. If you don't have the right sodium levels, it can cause low or high blood pressure. So yeah, be aware.
Eric also made a good point of like getting free samples from the companies of catheters. Sometimes it is the catheters. I've had people switch catheter companies and their whole perspective changed on their cathing experience. So yeah,
Yeah,
get samples if you.
And that's actually thank you for that. That's a perfect transition here to go ahead and real quickly thank our sponsors, mobility professionals and urology professionals. And I'll start with urology professionals today. Like Brianna just mentioned and Eric just mentioned in the chat, trying different catheters. That's one thing that even if you're not a client of urology professionals, I know for sure if you're thinking about switching or even if you're just having trouble getting some catheters, they will send you different samples of stuff to try out. They're just great with that kind of stuff. And obviously, they were probably going to hope you will transition and come over to them. But they're honestly just good people. I know Dean does stuff like that all the time. He sends people catheter supplies and different samples to either get them through a period they can't or just to try new things if they're having issues with what they're using. So
yeah,
yeah, and
Also, to mention if your insurance doesn't cover it, because I had a problem when I had to switch my insurance, you can straight buy from them too, and they do give a good discount. So if you see any
okay.
products on there, email them, and you can straight buy from them as well, which helps.
Yeah, and that's awesome. They will give you a little bit of a discount rate. They're not going to charge you what they would charge insurance for those same things. So yeah, we appreciate our sponsorship, and they are nationwide urology professionals. So anywhere in the country, if you do need catheter supplies, give them a call and they can help you get them just shipped right to your doorstep. And then real quick, Mobility Professionals is their sister company or the original company, and they are local to Southern California. They're a local DME. So if you need a wheelchair or standing frame,
Or a
remote chair,
bath
anything
bench
like
chair there,
bath bench,
Bernard.
anything like that. Yeah, any of the larger equipment, give them a call and they can get you all fitted up, sized up, and they will come also directly to you. If you're anywhere in the Southern California area, they'll come out and measure you, measure your area, get you all set up and fixed up with whatever you need. So we appreciate our sponsors. Um, and yeah, that's it for that. And like I said, we're definitely going to have to come back, and we will continue um, having these conversations. And if you're watching this after and you have a question or anything like that you want to mention, please leave them in the comments, because we will still, those comments will stay on there, and we can get to them, and we can't even answer them on the comment thing. And that's public for everybody to be able to check out and see. Or if you are uncomfortable doing a public comment, message one of us on Instagram, or anywhere else on our email, Instagram, anything like that. But our Instagrams are all below in the description, so you can reach out for anybody. Um, and yeah, that's about it for the show, you guys. Anything else that you guys want to finish up with? Anything wanted to mention?
No, I think just, you get into a rhythm with your bladder, stick with that rhythm, try not to change. Talk to others when you are having problems, see what works for them. And Eric said it best, maybe it's time to switch a different type of catheter. Like you guys said, uh, I switched and that worked a lot better. These companies will send out sample after sample. I've dealt with it. Not so much because our catheters don't really switch, but for colostomy supplies, it goes the same way. I just recently switched to something and it was amazing. They sent me tons of it. And after 4 years of not being fully independent, I am fully independent. No one touches my poop for the first time in 36 years.
That's
And
cool.
Great. Yeah.
nobody has to deal with it anymore.
Oh, that is really cool.
Yes,
See,
don't give up. Sometimes it sucks going through that trial and error, and it is annoying and it makes you frustrated. But make sure that you remember that there is light at the end of the tunnel. Don't ignore your body if it's telling you something. It is something that we have to deal with, so it's better to just figure out what works best for you, and then to go without it for so long. And you'll be much happier when you do.
Yeah.
Also, drink your water and take your vitamins and get your blood drawn.
Yeah, don't listen to Bernard.
Yeah, drink electrolytes too. It's not a scam, okay? I promise.
yeah, but even stuff like that, you do want to get your blood tested, like at the doctor's, to make sure you're not overdoing it, because then you're having high sodium content. But or like Bob, like he was low, so like that is something that you want to talk to a doctor about and get figured out, and get what you need to help, because you don't want to be
Or
living.
also, I know we're trying to end. Sorry, blood drawn is just good for your energy and body in general. You don't realize like how many vitamins like naturally like will pick up like your muscle pain and like stuff like that. Like it help you sleep better. Like or you like low iron. Like I'm getting bruises everywhere. Like you just take a little iron, girl, and you're gonna be okay. It's like very small things that can really help your body better.
Yeah.
Yay!
All right.
Yeah. Make sure you hit that like button. If you like
Yeah,
the show, like that button.
like, subscribe, please definitely follow. We'll be back next Tuesday and Thursday with live shows again. So make sure to tune in, check out those. Yeah, make sure you are subscribed or click that bell so you get the notifications for new Live to Roll content. All right, everybody, thanks for hanging out.
Yay.
And we will see you guys next week. Live to Roll.
Bye.